first of all, we have Canadian manufacturing capacity, and Mark led the company, one of the companies that had it, and we have the GSK in Quebec. It's been underreported or not recognized that we have vaccine capacity. It may not be the right type of vaccine, because certainly mRNA vaccines are new. Very few places had the ability to produce them. As I went through quickly, it's not just about having, first of all, there's the science base. So this question of, do we have the ability to develop or contribute to the development of vaccines? And we should really look at that. And part of the bioinnovation strategy that was in the federal budget is focused on that. We also need more capacity to be involved in the evaluation of the vaccines and running the trials, and the CERN network that Jeff is part of is there. But it's fair to say that we lag other countries in our ability to get the kinds of studies. The Joanne Langley study I mentioned, she's been working on that since January, and it was just announced last week. And the Spaniards are reporting the results. Like, we should be able to get these sorts of things up and running more quickly. In terms of having the actual manufacturing, and it could be licensing in and so on, it's one thing to say we can build the plants, and building the plants with time, we'll build the plants and so on. We need the personnel, and then we need the supplies. The Pfizer vaccine has, said, 200 components. We're not going to manufacture all 200 components in Canada. So we will always be at the risk of the global supply chains. And one of the things under the Trump bans in the United States, it wasn't just that they limited the export of the vaccines, they limited the export of the raw materials. And you remember the Indian Serum Institute begging Joe Biden to allow some of those raw materials, which the US no longer needed, to be exported. So even if we built our own capacity, we would still be in that situation of having to get the raw materials in if we didn't build up the capacity to do all that. And then the final thing, and again, Mark knows this really well, we can work really hard to get the plants. We have to buy the vaccines when we're not in the pandemic, right? Because global pharmaceutical manufacturers will put vaccine manufacturing plants where they think there's markets. And so what that really gets to, and I see a number of people on this that are in the health policy world, is that we have to be prepared to pay more for vaccines in non-pandemic times. And the deputy minister at ISED made a great point at a meeting. I think, Mark, you were at that meeting as well. And he said, the Army has contracts to buy bullets in a war. They pay more per bullet to a Canadian manufacturer, right? Because you want to have those plants there, you want to have that capacity. And so other countries that have maintained their capacity, like the UK, invests in non-pandemic periods, essentially subsidizes the cost of production so that you can compete with the global marketplace. And if we don't do that, we're not going to maintain that capacity in the intervals. And it's a complex set of issues. We want to have the lowest prices possible. And our procurement processes that the provinces use will result in the lowest price going if it's equal effectiveness. And that might mean it's a foreign manufacturer that gets those routine contracts for vaccines. And then we will lose the manufacturing capacity. And that's essentially what happened over the previous 30 or 40 years.